Welcome everyone to the Brain Health and Wellness Initiative series. Tonight, our presenter is Dr. Dennis Grossman, and he'll be talking about stress, mental health, and dementia. My name is Hannah Doles, and along with my colleague, Nicole Herbert-Hale, we provide care navigation in the JFSA Dementia Care Navigation Program. Our program establishes an empowering environment to help improve the quality of life of those who have dementia or at risk of developing dementia, while helping family caregivers reduce the stress and burden that often occurs while caregiving. At JFSA, we understand the importance in working with our clients' strengths and applying a person-centered approach to care, which extends throughout our multidisciplinary team of geriatricians, nurses, social workers, and geriatric psychiatrists. Nicole and I meet our clients where they are and develop individualized care plans that help produce solutions to presenting problems. From linking persons with dementia and their families with community resources to following them with their medical management, we are their point of contact for guidance as well as a listening ear. We consider the intersectionality of one's life when creating interventions that adhere to their biopsychosocial needs and experiences. If we can scroll the presentation to two slides, I want to point out how to use our Zoom webinar system. Perfect, thank you. At the end of our presentation, you'll notice at the bottom of the screen on the participants end, a Q&A button. If you could please enter your questions there at the end of the presentation, and we will answer at the end of the presentation. Try not to use the chat button, please. Okay. And then we are also offering CE credits. And I just wanted to note that it can take up to 30 days from the date of your application, which is really the completion of the survey, which will be emailed to you probably sometime tomorrow. Your CE certificate will be emailed to you at the email address you provided during registration. And the email address that you use to access the webinar must be the same one that you're providing. So if you enter a different one or an incomplete email address, it could prevent your CE from being issued. So if you have any questions about that, feel free to email Nicole or myself, and we can cross-check that to make sure you get the right, so you get your CE certificate. Right. So Dr. Dennis Grossman, he is with us tonight, and he is a graduate of Case Western Reserve School of Medicine with over 30 years experience in internal medicine. He has been on the staff of University Hospitals of Bedford and Ahuja Medical Centers, Cleveland Clinic, South Point and Marymount Hospitals, Metro Health Medical Center, former director of JFSA, and clinical director at the Case Western Reserve School of Medicine. Dr. Grossman served as chairman of medicine and chief of staff at UH Bedford Medical Center. He has affiliations with several nursing homes where he followed his patients after their discharge from hospital stays. He offers continuity of care and values the personal relationships with patients by following them over time with continuous monitoring to ensure positive health outcomes. For the past 30 years, Dr. Grossman has been interested in the effects of diet on chronic Western diseases and promoted plant-based diets and macrobiotic diets. Dr. Grossman believes that they play a key component in preventing and reversing some types of diabetes, hypertension, heart disease, stroke, and degenerative joint diseases. So without further ado, I will let Dr. Grossman take it away.
Thank you, Hannah. I want to thank JFSA for the opportunity to give some of these talks. I want to thank Nada Menlovic for doing the graphics. I write stuff out and she miraculously creates the graphics so that it's just not words. So I appreciate that. One key thing I want to say is there's a lot of information I'm going to give. I probably am giving too much information. Sometimes I'll give it 2 or 3 times. It's not meant for you to master what I'm giving you, but my term that I like to use is transformational, to allow you to, in some ways, think about it and maybe transform some of your thoughts about the subject and get you interested. And I'll have 3 references at the end. They're 3 books. They're really geared towards lay people, but also clinicians. And those are good references to sort of follow through and follow your journey along a little further. So, stress, mental health, and dementia. What role does stress have in the development of cognitive impairment? Well, we know there are a lot of factors that can contribute to decreased cognition. Aging, heredity, lifestyle, stress, hormones, and inflammation are 6 that are very prominent. I'm going to focus on stress, inflammation, and hormones, and what their role is in cognitive impairment and the development of it and the progression of it. So, what is stress? Stress is, in a definition, a state of strain or tension that an organism perceives. It can be a physical, an emotional, or a mental component, and it could be due to a perceived threat, which could be real or it could be imagined. When stress affects us, and we perceive a stress, and we perceive a threat of some sort, it affects 3 major systems in the body. The hormonal system, which is activated through your nervous system. And that hormonal system, which I'll explain later, creates an effect that secretes hormones that are stress hormones. The immune system. Stress affects various parts of the immune system. I list a few here: the spleen, the thymus, and lymph nodes. And then the gastrointestinal system, the intestinal organs, the digestive system, which is also affected by stress. They did a study on rats. Now, people aren't rats, but I think many ways we have similarities. And when they had rats that were subjected to prolonged stress, and they autopsied these rats, they found that there were 3 key changes. The adrenal glands, and the adrenal glands are what sit right on top of the kidneys. These adrenal glands became enlarged. The thymus, which is in the middle of the chest, and the lymphatic tissues, including the lymph nodes, they shrunk down. And the intestines, the lining of the intestines, became ulcerated. So these are the 3 systems that, under stress, are changed. How do we perceive stress? So here's a picture of a dog chasing the mailman, and obviously he's under some stress. But if that was your next door neighbor's dog who loves you, who's coming after you, you probably wouldn't perceive it as a stress. Same stimulus, different situation. So it's really a reaction, it's an interaction between a stressor and a processing system. How do we perceive the stress? Well, there are many things which control our behavior. First of all, do we recognize something as a stressor? Do we magnify or do we minimize the stress or the threats that we see? And a lot of that has to do with what is our own self-perception. Are we alone? Do we feel helpless? Or do we feel that we don't need help, or that we are not deserving of help? Do we feel as though we're loved or having to work to deserve love? Or are we unlovable? All these self-perceptions, which come from our personality, from our family, from our relationships, and childhood events, shape our stress response. So to understand our stress response, we have to look at a few things. We have to look at how it affects the brain. And by doing that, we have to also understand acute and chronic stress and the difference between it, and what our individual stress response is and how it affects the whole organism. So it might seem paradoxical to claim that stress, which is a physiological mechanism very vital to life, is actually a cause or a contributor to illness. So resolving this apparent contradiction, we have to differentiate between an acute stress and a chronic stress. Acute stress is immediate, short-term, a body's response to a threat which allows us to escape from danger. Chronic stress is activation of a stress mechanism over prolonged periods of time when the person is exposed to stressors that can't be escaped, either because one does not recognize them or because one has no control over them or chooses not to escape them. So what is chronic stress? Well, first of all, under chronic stress, which is a prolonged act, we no longer sense what's happening in our bodies, and we can't therefore act in a self-preserving way. It tends to wear at our bodies because we may no longer have the competence to recognize the signals of the stress. And chronic stress, and here's what I would like to emphasize, it prolongs the inflammatory reaction, which has a direct negative effect on the brain. The nervous system is activated when we are presented with a threat. And there's two opposing systems, autonomic systems, which are kept in balance, which is called homeostasis. So it's a delicate balance we have between sympathetic, which is our fight or flight system, and parasympathetic, which is our rest and digest system. In the sympathetic system, when it's activated under stress, we'll either fight, we will fly or run away, or if neither of those options are viable, we will shut down ourselves to survive. In the parasympathetic system, we rest, we replenish, we repair. We are allowed to create a situation where it's very helpful. You can activate your sympathetic system very easily by breathing in, which increases your heart rate a little bit. You can activate your parasympathetic system by breathing out, which decreases your heart rate. There's a lot of breathing exercises and a lot of techniques, especially in yoga, that utilize this. There's something called heart rate variability, which we are measuring when we do what's called an HRV test, meaning that we check what the variability is between beat to beat of your heart rate. It's an indicator of the health of your autonomic system. So the more heart rate variability you have, the better your autonomic system is in dealing with stress. So what happens in the sympathetic system when acute stress activates it? Well, there's a release of two hormones, cortisol and adrenaline. And these are both released in the adrenal glands, as you can see just above the kidneys. Chronic stress perpetuates this sustained release of cortisol and adrenaline, unlike acute stress, which the release is there and it goes away. And the system which is activated during this stress is called the hypothalamic pituitary adrenal system, HPA. And I'll explain that a little further. The hypothalamus, it is in the base of the brain. It isn't part of the brain, part of a very primitive area of the brain. When that's stimulated, it releases something called corticotropin releasing hormone. That's a fancy term for something that actually affects the pituitary gland, a part of the pituitary gland. And that pituitary gland, which is just under the brain, then releases something called adrenocorticotropic hormone, ACTH. That hormone circulates throughout the body and reaches the adrenal glands and releases cortisol. So the final common pathway of stress, of the stress response, is the adrenal gland. The hypothalamic pituitary adrenal axis is key to the stress response. Through this activation, both physiological and physical stimuli are set in motion in the body's response to threat. The final common pathway is through the hormones cortisol and adrenaline. And all of these effects are generated by the central nervous system, autonomic system, and by the hormones that it triggers. When a chemical is secreted from one organ and it influences another or any other part of the body, that's called an endocrine hormone. On a perception of a threat, the hypothalamus in the brain stem releases this corticotropin releasing hormone, CRH, and that travels to the pituitary at the base of the skull. And when stimulated, it releases the adrenocorticotropin hormone, ACTH. That is carried in the blood to the adrenal glands near the kidneys, and the adrenal gland secretes cortisol. Cortisol acts on almost every tissue from the brain to the intestines to the immune system to the bone. And here's just an example of what it does. It can weaken the immune response. It can create heart disease. It can elevate blood pressure. It can elevate blood sugar. It can cause ulcerations in the digestive tract, and it can cause nervous system dysfunction. The immune and nervous system, these are key to understanding what happens under stress. So the first essential task of the immune system is to distinguish self from non-self. In other words, what's you and what's non-you. And what's not you has to be further categorized as to something that is dangerous and non-dangerous. But the initial differentiation is that me or is that not me? The immunity really begins with recognition, which is a sensory function performed by the nervous system. In a sense, the immune system is a sixth sense and a sensory organ. Failure of the immune system to recognize leads to as much danger as if our capacity to see, to hear, to feel, to taste, or to touch were impaired. There's a second function of the nervous system, and that has to do with memory. The immune system must also have a memory in order to recall what is benign from what is potentially toxic. Thus, prior experience is a valuable component. With immune systems that are found throughout the bloodstream and in all the tissues and spaces of the body, we think of the immune system as a floating brain equipped to detect non-self. The self, who you are, is identified by what we call self-antigens, which are proteins found on the surface of every cell in the organism. Cognitive decline is probably triggered by chronic stress acting on an aging immune system through three mechanisms that are related to inflammation. And I brought up inflammation in the beginning, and we are now really looking at how important and how key it is to the development and or progression of cognitive decline. There's a term called inflammaging, which is a combination of inflammation and aging, referring to the effects of an inflammatory reaction in the brain, and it is accelerated in dementia. So there are three components. One has to do with inflammation affecting the vascular system in the brain. The small blood vessels in the brain are actually deteriorated by an inflammatory situation. And the second is the breakdown of the blood-brain barrier, the actual protective layer that coats the brain that is not allowing toxins or things into the brain that shouldn't be there. And that is also broken down. And third, there is a negative effects of direct negative effects of cortisol on the memory areas of the brain known as the hippocampus. So inflammation is one of the tools the immune system uses to keep us safe. The immune system's job is to protect the organism from threats, both real and imagined. The stress response system is activated during these perceived threats. Acutely, this is the classic fight or flight, and chronically, these stressors give us elevated cortisol and adrenaline levels. The keys to a dementia. In 2021, there was a hypothesis by Antoine Hakim of the Brain and Mind Institute of Ottawa. He proposed the following mechanism. Certain lifestyles negatively impact cognition through the same sequence of events: inflammation, decline in cerebral perfusion, small blood vessel disease, brain atrophy. Inflammation, he said, was linked to cognitive decline through a breakdown of the blood-brain barrier and its damaging effects on small blood vessels in the brain and the direct effects of hormones on the brain itself. In addition, when we age, our hormones change. Like it or not, there's a gradual reduction in anabolic steroids. Anabolic meaning the steroids that build you up. The testosterone and estrogen hormones. These hormones are known to enhance cognition. As we age, there's a gradual decline. But simultaneously, we develop increased levels of the catabolic, which is the breaking down hormone, glucocorticoid cortisol, which diminishes cognition. So as we age, our ratio of cortisol to androgens increases. The more cortisol and the less androgens, we get a higher and higher ratio and an acceleration of cognitive decline. One of the structures to deteriorate in Alzheimer's is the hippocampus. It's a center of gray matter in the temporal lobes of the brain next to your ears. It's active in memory formation, and it has an abundance of cortisol receptors. During times of stress, the hypothalamus signals the pituitary gland to release the ACTH, which in turn signals the adrenals to release cortisol and adrenaline. What you get is chronically high levels of cortisol, and this actually shrinks the hippocampus. In addition, the adrenaline, which is elevated, is a vasoconstrictor of the cerebral vascular bed and is found in high concentration in Alzheimer's cerebral spinal fluid. So the brain's stress response mechanisms are programmed by a myriad of things. Much of the time, it's about experiences that take place in infancy and young life. And so are the implicit unconscious memories that govern our attitudes, our behaviors towards ourselves and others, and the world. The absence of something or someone creates stress, which is perceived in our world to be a threat. So this may be the absence of food, of shelter, of nurturing. All of these create stress. All stressors represent the absence of essential features in the environment, features that the organism perceives as necessary for survival. In addition, there's another factor, which is the gut-brain connection. The brain relays data about sensory organs such as eyes, ears, skin, and the gut. And the resulting physiological events in the gut reinforce emotional interpretations. These signals are sent back to the brain through transmitters from the gut when we perceive threat, and we can apprehend consciously. The gut feelings are part of our body's sensory apparatus. They help us evaluate the environment, whether a situation is safe or not. This is just a schematic of the interaction between the gut-brain axis. There are normally 3 stages to a perceived threat. First, as a social being, when we perceive a threat, we look to others around us for help and guidance by communicating our situation. Failing that, we rely on the sympathetic response of fight or flight. And finally, by failing that, we go into self-preservation, a shutdown mode to preserve our bodily functions. Many times in modern society, the first step is not available. And so we rely on steps 2 and steps 3. Not only have we been unable to rely on our fellow society members for direction and support in times of stress, we may also lose touch with those gut feelings that are designed to be our warning systems. The body mounts a stress response, but the mind is unaware of the threat. So we keep ourselves in physiological stressful situations with only a dim awareness at all. We might not even know that we are under stress, yet physiologically we are. Most of our stressors today are emotional. Just like the lab animals that are unable to escape, people who find themselves trapped in lifestyles and emotional patterns detrimental to their health are under stress. Additionally, the higher the level of economic development, the more anesthetized we have become to our emotional realities and our gut reactions. The more disconnected we are from family and from intergenerational support, the more unconscious stress the elderly feel in terms of their waning years. Will they have to be in assisted living? Will they have to go to a nursing home? Will they be neglected by their children, by their support systems? All these are the modern stressors that either consciously or subconsciously are around them. The fight or flight alarm reaction exists today for the same purpose that it originally evolved from, to enable us to survive. But what's happened is that we lose touch with the gut feelings designed to be an early warning system. The body mounts a stress response, but the mind is unaware of the threat. So we keep ourselves in a physiologically stressful situation with only a dim awareness at all of what's going on. There's a term called emotional constriction, which is a learned behavior. Emotional constriction and denial are defenses against an allostatic load. And I have to define this term allostatic load. We refer to allostatic load as an increased load of stress to a point where the system can no longer deal with it. This is actually a multifactorial situation. It has to do with if someone experiences powerlessness, loss of control, or is in constant fear. There may be early life situations or experiences in response to unpredictability of food, nurturing, or safety, which can increase the allostatic load throughout life. And if we are unable to be in touch with our emotions and express them in a healthy way, we will also carry forward this enhanced allostatic load. Early relationships may be critical in the later development of dementia by teaching or not teaching healthy ways of responding to stress. There was a study about non-handled rat pups versus handled rat pups, and that the non-handled rat pups developed smaller hippocampuses as an adult and were less able to do tasks through mazes as adult rats. The paucity of the richness of language is also related to the quality of emotional relationships early on in life and the subsequent development of dementia. There's little doubt that the chronic activation of the immune system plays a role in neurodegeneration or Alzheimer's disease. Chronic stress acts on an aging immune system to create deterioration. The cumulative effect of stress, impairment of cognitive function, is preceded by a decline in emotional control. Depression and emotional constriction are both defenses against an allostatic load that is too high, so that we shut down, we become depressed, and we're unable to deal with our emotions. When the load is perceived as life-threatening, the neuronal circuitry is changed. The defense mechanism no longer alleviates or lessens the load. Depression and other illnesses ensue. Excessive allostatic loads contribute to decreased sizes of the hippocampus and the amygdala. Now, the amygdala is also a primitive brain structure, and it has to do with emotions. The hippocampus is key to memory. Amygdala is key to emotions. If we fail to regulate our emotions by suppression or emotional constriction, it is costly. It taxes the physiological functioning, such as memory impairment, which is found in dementia patients. Inability to face stress will impact a patient's cognitive function. If shutting down emotionally appears early enough in life, the capacity to recognize reality is impaired, and the immune system is unnecessarily activated. Emotional competence. The quote is, "If you feel, you heal." The capacity to feel our emotions, to deal with our emotions so that we are aware of them when we experience stress is key. The ability to express our emotions effectively and thereby to assert our needs, to maintain the integrity of our emotional boundaries are key to health. The ability to distinguish between physiological reactions that are pertinent to the present situation and those that represent residue from the past is also key. What we want and demand from the world needs to be to conform to our present needs, not to unconscious, unsatisfied needs from our childhood. If distinctions between the past and the present blur, we'll perceive loss or the threat of loss where none exists. And the awareness of these genuine needs that do require satisfaction, rather than their repression for the sake of gaining the acceptance or approval of others, is key. We want to be able to satisfy those needs in a real way. Emotional competence is what we need to develop if we are to protect ourselves from the hidden stresses that create a risk to health, and it is what we need to regain if we are there willing to heal. The ability to be in touch with our feelings is key. We need to foster emotional competence in our children, which is the best preventative medicine. So I've given you a lot of information, some of it based on medical, some of it based on psychological. I've given 3 references here. These are 3 books that deal with some of this in different ways. I think it's important that we don't ignore the part of cognitive decline that has to do with our emotional state and the ability to deal with stress. And I think that's important for those that have cognitive decline, but it's also just as important for those who are caregivers, who are actually also under stress in terms of their ability to deal with what's in front of them and remain healthy for themselves and for their loved ones. So thank you. I know it's a lot of material. And hopefully you can get more information from these books.
Thank you. All right, well, we have some time for questions. All right, I did get a question. Do anti-inflammatory drugs help reduce the brain's inflammation, reducing the changes associated with cognitive decline?
That's a good question. There have been some anecdotal studies that have linked non-steroidal and anti-inflammatories, your Motrins, your ibuprofens, with a lower likelihood of developing some cognitive decline. So I wouldn't say go out and start taking those medications because they have a lot of side effects. But there is a little bit of information out there, and you can Google it, that there is some positive response to that.
How can we become more emotionally competent?
So that's
a big question.
And that's a good question. Way above my pay grade, but I think I started the talk with the term transformation. I think it has to do with a person being willing to look at those things and maybe through some guidance or some help professionals to be able to identify what triggers there are and what's from the past and what's from the present. And, it's something I think that can be practiced and maybe improved upon in terms of one's ability to react in a different way. So it's probably a learned response, just like, we learn responses that are non-healthy. So, but again, it's above my pay grade. So maybe the next lecture, but I don't think so.
You mentioned how life experiences can create stress or threaten survival. Are there studies on how people who go through traumatic experiences end up getting cognitive decline or even dementia?
So the studies have shown what's more important is not dealing with those stresses and not processing them as an adult, so that it's not that going through stressful situations younger in life will create a situation where you're prone to getting cognitive decline. It's the what they call emotional constriction, where you don't want to look at it. Where and they've shown this, that if you don't have healthy emotional responses, which goes back to dealing with whatever traumas you've had, then you will later in life choose not, well, sort of shut down, I guess. And really, if you think about dementia in a sense, it's a bit like shutting down. It's kind of one of your organisms. We talk about heart failure. If a person has unhealthy lifestyle, or doesn't exercise or whatever, they may go into heart failure. Well, I think with dementia, it's brain failure. It's just, not dealing with things in a healthy way, not exercising that, not facing things in the present that may have to do with the past, but in a way that's healthy. So I'm not sure if that answered it, but it's not that you have trauma that creates that you can't escape this cognitive decline. It's having trauma and not dealing with it and not processing, and then running away from it, avoiding it, negating it, and shutting down. And that is the real key.
kind of going off of that, and this is something I was thinking with the population we work with here, but someone asked, how has the lockdown of COVID affected Holocaust survivors?
So, yeah, so it probably has affected them much more than the general population. And I'm not sure if that's been addressed, maybe on an individual basis, but I'm sure that that definitely, that's a trigger
Yes,
for them,
I can certainly comment that we've had, and this was probably when things first started in March 2020. It was a very triggering time for some of our clients, unfortunately. And even clients with dementia with no trauma, we certainly have seen a decline, unfortunately, in the
Right.
pandemic.
Yep.
Thank you for that question. How can we soothe our gut feelings of anxiety when our sensory organs are sending signals back to the brain that trigger stress?
So there's a term called, get the right, vagal tone is the term we use. So the vagal nerve is the 10th cranial nerve, and it actually starts in the brainstem. It goes down through the larynx, down through the gut to the heart. It regulates heart rate, breathing, goes into the lungs, but it also is the nerve, the autonomic nerve that innervates the gut. So the gut brain, the gut brain axis is a two-way street. And one of the keys is to increase your vagal tone. And one of the ways of increasing vagal tone is doing breathing exercises, or practicing things that stimulate the vagal nerve. And that may be practices like meditation or yoga, certain lifestyle things, exercising. They increase the vagal tone. The better the vagal tone, the less there is stress on the system, especially the gut. I mentioned before heart rate variability. It's quite interesting. So there are these intricate ways of measuring the minutest variability from beat to beat of your heart rate. I mean, it's in milliseconds. And it's one of the most predictive ways of determining somebody's health and longevity and ability to be disease-free by their heart rate variability. Vagal tone, again, doing things that activate the vagal tone, just things, even being around family and familiar things, having conversations, interpersonal relations, those all activate the vagal tone. Isolation is the exact opposite. Trauma is the exact opposite. They all activate the sympathetic system. So finding the things that can improve your vagal tone will help.
Thank you. What are the physical symptoms of stress? And there may be some that may not be maybe easy to recognize. And how do you recognize that?
Yeah. Hyper alertness, increased heart rate, sometimes shallow breathing, it depends on what your history is, but the adrenaline that's going through your body, it increases circulation to your muscles. It raises your heart rate. It raises your blood pressure. It makes you more sensory aware, so hypervigilant. So those types of things, and every individual may have a different. It may affect their organs differently, but adrenaline affects lots of the body systems. I can't. Your vision gets better, your hearing gets more acute, you're more sensitive to touch, to anything, to noise. You're on the look. It's like you're on the lookout for the predators coming after you, if you put it in primitive terms. And the threat may be just somebody yelling at you, may trigger, and it triggers all those things. Unrelated to somebody actually going to do anything, but it just may activate that system through either your memories or through your perception. Again, it's how you perceive something is based on who you are and what your history is in terms of trauma.
We have time for one more. As a society, we work hard for our goals, which can be stressful, such as going to college or working toward a promotion. Is that really harming us in the end?
That's again a very good question. I think what harms us is being disconnected from our ability to perceive things as they are. And if we're so goal-driven and we lose that ability, or we don't think that's important and that only goals are important, then that is harmful. So it's a delicate balance. There's nothing wrong with goals. There's nothing wrong with that. There is, there are some studies with primitive cultures. It's quite interesting, because we perceive ourselves as being advanced and having all this leisure and this and that. They found that in primitive cultures, foragers and hunter-gatherers, that they actually work 2 to 4 hours a day, and that the rest of the time they spent doing what they like, conversing, and in our society, we put a premium on, work and time spent and all that. And are we better off, or were they better off? Hard to tell, but I think there's a delicate balance in, being goal directed, that's good. But if it's at the expense of, knowing who you are, nurturing and being able to be in touch with your emotions and being able to connect with the world around you and the people around you, which is really important, then, you can do both, but you shouldn't give up one for the other. So it's kind of a roundabout answer, but I think yes and no. So.
Thank you. All right. Well, one more maybe. So thank you again, Dr. Grossman. A little bit more about our program at JFSA here. Nicole, Herbert Hale, and myself, we are both care navigators for the Dementia Navigation Program. We work with clients in the community who have dementia or who are at risk of developing dementia. So we are always open to talking with families out in the community, if you have questions or concerns about a loved one or a friend, we talk to people every day and give referrals and try to support the community. Next slide, please.
Uh-oh.
I wanted to mention we have two geriatricians that work with us, Dr. Elizabeth O'Toole and Dr. Constance Magulias. They both come to us here at Allison's Place Clinic at our JFSA building, and they meet with our clients and really work with Nicole and myself to discuss different recommendations and interventions for clients. So we work with them to really put things into place to make it safer at home. Next slide, please. And then we have Leanne Stuver that works with us. She is one of our Savvy Caregiver Workshops facilitators. She also runs our support group with us. And then Frank Petrelli is also part of our team. He helps us with our cognitive testing here at JFSA. Our Savvy Caregiver Workshop, we're in the midst of one right now. It is a 6-week course for family caregivers, and we do offer it throughout the year. We hold a monthly dementia support group, again, for family caregivers, also meeting through Zoom. We have respite available for family caregivers, and we run our monthly Brain Health and Wellness Initiative series. And next month, Leanne Stuver will be joining us on Thursday, June 23rd at 6:30, presenting on Make Sense of Your Brain. So again, please feel free to call or email us with any questions about our program and resources. We hope you will join us next month. Thank you, everyone.